Are there any other nutritional supplements that you tend to use regularly, particularly as people age? I know we mentioned
Yeah.
CoQ10 before, magnesium, D-ribose, L-carnitine,
Right. Those are mitochondrial support, and I will use those. Some people, after the virus causing the pandemic, feel better with some mitochondrial support too. That's just an observation. That's not a published study. Omega-3 supplements, CoQ10, there's a randomized study from Sweden. If you're 70 and older and take CoQ10 or take placebo, you have much better heart health taking CoQ10. So it is actually evidence-based. It's not just a sales item. There are some people low in B12 folate. And if you have a high homocysteine, you need a B complex vitamin. And even the biggest multivitamin skeptics know that there's data that folate and B12 supplementation, like a B complex, has been associated with better survival, lower rates of stroke. Probably that's through homocysteine. Then there's everything else. I mean, I'm up to date on it. NAD, NMN, nicotinamide riboside, NR, an interesting compound called spermidine. I have a bottle sitting to my right, which is a food-based wheat germ, maybe promoting autophagy. And there's other vitamins that may promote eliminating senescent cells, so-called senolytics. There's vitamins that mimic fasting, bergamot, berberine, resveratrol, spermidine. But we need, if somebody really wants, go for it, and I'll design them a program. But that's for the person that recognizes we don't have the full picture on any of those. So most of my patients are on, probably vitamin D, CoQ10, perhaps a B complex. And there's a very interesting plant-based antioxidant called pycnogenol, Pycnogenol. It comes from the bark of French pine trees. And it has some very powerful effects on arteries. That's in the human scientific randomized study literature. And there's new data that pycnogenol from the bark of a French pine tree, because it's very protective of arteries, may be protective from the bad consequences of the pandemic. These are actually published human studies. So I have a lot of people taking pycnogenol. It also is anti-inflammatory. So if your C-reactive protein is up, work on your diet and everything else, but pycnogenol helps a lot.